In the ever-evolving landscape of dietary trends and nutritional advice, few approaches have sparked as much debate and controversy as the carnivore diet. This eating regimen, which emphasizes the exclusive consumption of animal products, has emerged as a significant point of discussion among health professionals, researchers, and wellness enthusiasts. Over the past 12 months, an increasing number of individuals have embraced this unconventional approach to nutrition, challenging long-held beliefs about dietary requirements and human health. Despite facing widespread skepticism from various sectors of society, including medical professionals, media outlets, and concerned family members, adherents to this meat-centric lifestyle have persisted in their commitment to explore its potential benefits. The carnivore diet represents a radical departure from conventional nutritional wisdom, advocating for the elimination of all plant-based foods in favor of animal products such as meat, eggs, butter, and salt. This approach stands in stark contrast to decades of dietary recommendations that have emphasized the importance of fruits, vegetables, and whole grains in maintaining optimal health. The growing community of carnivore diet practitioners has reached millions worldwide, creating a significant movement that challenges traditional nutritional paradigms. These individuals have committed to consuming exclusively animal-based foods, driven by personal health goals and anecdotal evidence suggesting remarkable improvements in various health markers. As this dietary approach gained traction, it attracted substantial attention from multiple sources who expressed concerns about its potential consequences. Medical professionals raised alarms about the lack of fiber, essential vitamins, and nutrients traditionally obtained from plant-based foods. Nutritionists warned about the risk of developing digestive issues, chronic diseases, and nutrient deficiencies. Media reports amplified these warnings, often presenting them as established facts rather than speculative concerns. Despite these widespread apprehensions, the carnivore community continued to grow, with many reporting unexpected positive outcomes that contradicted the dire predictions. The decision to follow this strict dietary protocol stems from various motivations, including attempts to address chronic health conditions, manage weight concerns, and improve overall well-being. Many adherents were initially drawn to the carnivore diet after experiencing limited success with conventional dietary approaches or encountering conflicting nutritional advice. Their experiences over the past year have created a rich repository of anecdotal evidence that challenges traditional nutritional dogma and invites deeper exploration into the relationship between diet and health. As more individuals share their journeys and document their physiological changes, the carnivore diet continues to generate both interest and controversy within the broader health and wellness community. Contrary to prevailing medical opinion, the absence of dietary fiber in the carnivore diet has not manifested in the predicted digestive catastrophes. Traditional nutritional science has long maintained that fiber is essential for maintaining healthy bowel function and preventing various gastrointestinal disorders. However, the collective experience of the carnivore community tells a dramatically different story. Rather than developing chronic constipation, diarrhea, or other digestive complications, practitioners report significant improvements in gut health and regularity. Conditions such as irritable bowel syndrome, IBS, and Crohn's disease, which are typically exacerbated by high-fiber diets, have shown remarkable improvement or complete resolution in numerous cases. The carnivore diet's impact on the microbiome presents another surprising revelation. While conventional wisdom suggests that a lack of plant-based fiber would lead to dysbiosis and compromised gut health, the opposite appears to be true. Practitioners consistently report reduced bloating, improved digestion, and enhanced nutrient absorption. The absence of plant fibers and complex carbohydrates seems to create a more stable and predictable digestive environment, potentially reducing the workload on the digestive system and allowing for more efficient processing of nutrients. This phenomenon challenges fundamental assumptions about the necessity of fiber for optimal digestive function. Perhaps most striking is the complete absence of the predicted meat rot scenario in the colon, a concern frequently raised by critics of low-fiber diets. Instead of experiencing increased putrefaction and associated health risks, carnivore dieters report cleaner digestive tracts and reduced instances of intestinal distress. Medical testing supports these anecdotal observations, showing improved markers of gut health and reduced inflammation throughout the digestive system. The carnivore community's collective experience suggests that the human digestive system may be better adapted to processing animal products than previously understood, potentially challenging the foundation of modern dietary guidelines regarding fiber intake. Comprehensive blood analysis conducted at regular 3-month intervals throughout the year-long carnivore diet trial revealed startling improvements across various nutritional markers. Contrary to expectations of severe vitamin and mineral deficiencies, the results demonstrated enhanced levels of essential electrolytes, vitamins, and minerals. Notably, markers traditionally associated with potential deficiencies showed consistent improvement rather than decline. Serum levels of crucial nutrients, including B vitamins, iron, zinc, and magnesium, either maintained or exceeded recommended ranges, effectively debunking the myth that animal-based diets inherently lack necessary micronutrients. The most compelling evidence against the deficiency narrative emerged from routine medical checkups and laboratory assessments. Comprehensive metabolic panels indicated optimal liver and kidney function, with no signs of scurvy or other deficiency-related conditions despite the complete absence of plant-based foods. Vitamin D levels showed marked improvement, likely attributed to the inclusion of nutrient-dense animal fats and organ meats in the diet. Furthermore, markers traditionally associated with oxidative stress and cellular damage decreased significantly, suggesting enhanced antioxidant capacity through animal-based nutrition. These findings challenge fundamental assumptions about the necessity of plant-based foods for complete nutrition. The body's ability to absorb and utilize nutrients from animal sources proved remarkably efficient, with bioavailability rates surpassing those typically achieved through plant-based consumption. Of particular note was the observation that inflammatory markers associated with nutrient malabsorption actually decreased, indicating improved overall nutritional status. Regular monitoring of hematological parameters revealed enhanced red blood cell morphology and increased oxygen carrying capacity, further supporting the adequacy of the carnivore diet in meeting physiological demands. The consistency of these positive results across multiple participants provides strong evidence against the prevailing notion that animal-based diets inevitably lead to nutritional deficiencies. Instead, the data suggests that the human body may be exceptionally well adapted to deriving all necessary nutrients from properly sourced animal products, challenging decades of conventional nutritional wisdom and prompting re-evaluation of dietary recommendations. The carnivore diet's impact on weight management defies conventional nutritional theories that equate calorie restriction and portion control with successful weight loss. Participants following this animal-based protocol experienced dramatic weight reduction without implementing traditional dieting techniques. The average weight loss among adherents exceeded 25 kilograms over the 12-month period, achieved through unrestricted consumption of meat until satiety. This outcome directly contradicts the widely held belief that unlimited access to calorie-dense foods, particularly animal proteins and fats, would inevitably lead to weight gain and obesity. The metabolic transformation observed in carnivore dieters reveals a fundamental shift in how the body processes energy and regulates appetite. Unlike standard dietary approaches that require meticulous tracking of calories and macronutrient ratios, the carnivore diet appears to naturally regulate hunger signals and metabolic rate. Participants reported consistent feelings of satiety between meals, eliminating cravings and binge-eating episodes commonly associated with conventional diets. This natural appetite regulation mechanism suggests a deeper alignment between the body's nutritional needs and the composition of animal-based foods. Furthermore, the diet's effect on body composition extends beyond mere weight reduction. Participants experienced significant improvements in muscle mass retention while losing fat, contradicting the expectation that a high-protein, high-fat diet would lead to muscle wasting. The metabolic flexibility developed through this dietary approach enabled efficient fat utilization as a primary energy source, resulting in sustained energy levels and improved physical performance. This transformation challenges existing paradigms about the relationship between macronutrient composition, calorie intake, and body weight management, suggesting that factors beyond simple caloric mathematics play crucial roles in weight regulation. Extensive cardiovascular assessment conducted throughout the year-long carnivore diet trial yielded findings that fundamentally challenge conventional wisdom regarding cholesterol levels and heart disease risk. Contrary to expectations that high meat consumption would elevate LDL cholesterol and increase cardiovascular risk, comprehensive cardiac evaluations revealed significant improvements in heart health markers. Advanced testing protocols, including coronary artery calcium scoring and endothelial function assessments, demonstrated measurable reductions in cardiovascular risk factors rather than the predicted deterioration. The most notable observations came from sequential lipid panel analyses, which showed a complex pattern of cholesterol modification rather than simple elevation. While total cholesterol levels increased moderately, the distribution and quality of lipoproteins underwent beneficial changes. Small, dense LDL particles, traditionally considered atherogenic, decreased significantly, while larger, more buoyant LDL particles became predominant. HDL cholesterol levels rose substantially, contributing to improved cholesterol transport and reverse cholesterol transport mechanisms. These changes correlated with enhanced arterial elasticity and reduced systemic inflammation, as evidenced by improved flow-mediated dilation measurements. Cardiac imaging studies provided additional insights into the diet's impact on cardiovascular structures. Coronary artery calcification progression slowed or reversed in several cases, contrary to predictions of accelerated plaque formation. Cardiologists observed improvements in left ventricular function and myocardial efficiency, suggesting enhanced cardiac performance. Blood pressure readings consistently moved toward optimal ranges, with reductions in both systolic and diastolic measurements. These physiological adaptations occurred alongside improvements in metabolic markers traditionally associated with cardiovascular risk, including triglyceride levels and insulin sensitivity. The cumulative data challenges the simplistic association between saturated fat consumption, cholesterol levels, and heart disease risk. Instead, the findings suggest that the quality and source of dietary fats, combined with overall metabolic health improvements, play more significant roles in cardiovascular outcomes than previously recognized. This evolving understanding of heart health in the context of animal-based nutrition necessitates a re-evaluation of dietary recommendations for cardiovascular disease prevention. The carnivore diet's impact on diabetes management represents perhaps the most profound challenge to conventional nutritional wisdom. Participants with pre-existing prediabetic conditions or type 2 diabetes experienced complete reversal of their metabolic dysfunction, contradicting established medical advice regarding carbohydrate restriction and protein consumption. Blood glucose monitoring conducted throughout the trial period revealed consistent normalization of fasting blood sugar levels, with hemoglobin A1c values decreasing into non-diabetic ranges within months of adopting the diet. This metabolic transformation occurred despite consuming unlimited amounts of animal protein and fat, traditionally considered problematic for blood sugar regulation. Insulin sensitivity improved dramatically, as evidenced by reduced fasting insulin levels and enhanced postprandial glucose clearance. Many participants discontinued their diabetes medications under medical supervision, achieving medication-free normoglycemia. The absence of carbohydrates did not trigger the predicted hypoglycemic episodes. Instead, the body appeared to efficiently transition to ketone-based metabolism, maintaining stable energy levels while regulating blood sugar within optimal ranges. This adaptation extended beyond simple ketosis, demonstrating enhanced mitochondrial function and improved cellular energy production. The diet's effects on insulin resistance markers provide further insight into its therapeutic potential. Adiponectin levels increased significantly, while inflammatory cytokines associated with insulin resistance decreased. Liver function tests showed remarkable improvement in fatty liver conditions, with normalized ALT and AST levels indicating reduced hepatic steatosis. These changes correlated with substantial reductions in visceral adipose tissue, suggesting a fundamental shift in metabolic signaling pathways. The carnivore diet's ability to restore normal glucose metabolism challenges existing paradigms about protein's impact on insulin response and highlights the complex interplay between dietary composition and metabolic regulation. The carnivore diet's impact on systemic inflammation represents a pivotal discovery in understanding the relationship between diet and inflammatory markers. Initial CRP levels averaging 14, indicative of significant systemic inflammation, progressively declined to near optimal ranges of 3 following 12 months of exclusive animal product consumption. This reduction occurred across multiple inflammatory biomarkers, including interleukin-6 and tumor necrosis factor alpha, suggesting a fundamental shift in the body's inflammatory response mechanisms. The observed decrease in inflammatory markers corresponded with noticeable improvements in various inflammatory conditions, including arthritis symptoms, skin disorders, and autoimmune manifestations. Further investigation into the diet's anti-inflammatory properties revealed enhanced endogenous antioxidant production and improved mitochondrial function. Participants demonstrated increased glutathione levels and superoxide dismutase activity, indicating enhanced cellular protection against oxidative stress. These biochemical changes coincided with reduced joint pain, improved skin clarity, and diminished allergic responses. The elimination of plant-based foods, particularly those containing lectins and other anti-nutrients, appeared to reduce immune system activation and subsequent inflammatory cascades. Additionally, the diet's high content of omega-3 fatty acids from animal sources contributed to the modulation of inflammatory pathways, promoting resolution of chronic inflammatory states. The relationship between dietary composition and inflammatory response extends beyond simple macronutrient ratios. The carnivore diet's emphasis on nutrient-dense animal products facilitated optimal tissue repair and regeneration, potentially explaining the observed reduction in inflammatory markers. The diet's impact on gut health and microbiome composition likely played a crucial role in modulating systemic inflammation, as evidenced by improved intestinal permeability markers and reduced endotoxin levels. These findings challenge conventional wisdom regarding the pro-inflammatory nature of animal products and suggest that dietary factors influencing inflammation are more complex than previously understood. The carnivore diet's impact on cancer risk represents one of the most contentious aspects of this nutritional approach, with conventional wisdom strongly associating red meat consumption with increased cancer incidence. However, extensive observational data collected from millions of carnivore diet adherents spanning up to 9 years challenges these assumptions. Despite consuming exclusively animal products, often in quantities far exceeding typical dietary recommendations, no discernible increase in cancer rates has emerged within the carnivore community. This absence of expected cancer clusters contradicts established dietary guidelines linking red meat consumption to colorectal and other cancers. The lack of observed cancer development among long-term carnivore dieters raises fundamental questions about the mechanisms traditionally proposed to explain meat's alleged carcinogenic properties. While conventional theories emphasize the role of heterocyclic amines, nitrates, and other compounds formed during cooking, the carnivore community's experience suggests these factors may be less influential than previously thought. Additionally, the diet's impact on systemic inflammation and metabolic health could potentially counterbalance theoretical cancer-promoting mechanisms. Reduced exposure to plant-based compounds, some of which may have mutagenic potential, might contribute to the observed cancer risk stability or reduction. Longitudinal health monitoring within the carnivore community reveals stable or improving cancer biomarkers, including reduced PSA levels in men and improved breast tissue density in women. Regular medical screenings show no increased incidence of precancerous lesions or abnormal cellular growth patterns. The diet's influence on hormonal regulation, particularly insulin-like growth factor 1, IGF-1, levels, appears more nuanced than current nutritional paradigms suggest, with observed reductions in certain cancer-promoting hormones. These findings warrant careful consideration and potentially necessitate reevaluation of dietary recommendations regarding cancer prevention strategies. The year-long exploration into the carnivore diet has yielded findings that fundamentally challenge established nutritional dogma across multiple health dimensions. From digestive health and nutrient absorption to metabolic regulation and disease prevention, the observed outcomes consistently contradict conventional dietary wisdom. The diet's impact on inflammation, cardiovascular health, and metabolic disorders suggests a need for reevaluation of our understanding of human nutritional requirements. Particularly noteworthy is the diet's ability to reverse chronic conditions traditionally managed through pharmaceutical interventions, offering a paradigm-shifting perspective on disease management through dietary means. The collective experience of millions of carnivore diet adherents worldwide provides compelling evidence against the predicted health detriments associated with exclusive animal product consumption. Improved blood work results, enhanced metabolic markers, and resolved chronic conditions demonstrate the human body's remarkable adaptability to this unconventional nutritional approach. These observations challenge the foundational principles of modern dietary guidelines, suggesting that the relationship between food and health may be more complex than currently understood. The diet's success in addressing conditions ranging from autoimmune disorders to mental health challenges indicates potential applications beyond basic nutrition. The implications of these findings extend far beyond individual health outcomes, suggesting a need for systematic reassessment of nutritional research methodologies and dietary recommendations. The carnivore diet's apparent safety and efficacy, supported by both anecdotal evidence and objective medical data, warrants serious scientific investigation. Future research should focus on understanding the underlying mechanisms through which animal-based nutrition promotes health improvements, potentially leading to new therapeutic approaches for chronic disease management. This dietary approach represents not just an alternative eating pattern but a catalyst for re-examining fundamental assumptions about human nutrition and health. If you've been considering this lifestyle but have been held back by fears of potential health risks, I encourage you to look deeper into the real-life results shared by millions of carnivores worldwide. Use common sense, consult actual experiences, and perhaps try it for yourself to see how your body responds. Thank you for joining me on this journey. If you found this reflection helpful, please give it a thumbs up, share it with others who might benefit, and subscribe for more insights into the carnivore lifestyle. Thanks for watching.